Hi friends, I have the honor to introduce to you Dr. Shaily Saraf. She is ranked 12 PGI Chandigarh, May 2018. It's an awesome performance. Heartiest congratulations.
Thank you, sir.
So how are you feeling today?
Sir, it's a great feeling. I'm feeling blessed. I did not imagine that I would do this much, but with the help of DAMS and with the support of my parents, I could make it to this level. So it's a great feeling. In one word, I would say I feel blessed.
Now you were telling me that you joined us in your foundation course in your 6th semester, I think, and
yes, sir.
And then you followed it up with a test and discussion course.
Yes, sir.
So how was your experience with DAMS? You know, when you entered DAMS for the first time in the foundation course, how was that experience?
Sir, at the time of foundation, we're not very much well versed with any of the subjects and how the exam pattern is asking things, and even our professionals are not very strong. So joining early is an advantage because you get to know about the subject much more. You understand the professionals also very well. So you concentrate more on your professionals, and practicals also you get to understand better, and that actually helps you in your exam. And the pattern of questions that the exams are asking nowadays is very much practical. So if you understand your subject well in your professionals, it's better to score well in the exam also. So and the pattern of questions is very much just like the DAMS tests are asking. So we get a better idea of how to study, what to study, because the syllabus is so much, we cannot study everything and anything. So it gets you a targeted approach to study and to study well and understand also.
So you used the DAMS classes to guide you to read your theory books better.
Yes,
and
sir,
they even
definitely.
help you in your professional
Practicals
exams
also,
and the practicals,
true,
and
true.
They formed the concept which helped you in the later time in the central exams.
Yes, sir.
Because today the central exams have gradually gone away from the repeat things to more of understanding and concept. You have to know your subject well.
True.
So probably that.
Yes, sir. Yes, sir.
So then, you know, any particular teacher that you remember from that time, you know, when you were in the foundation year, any teacher that you remember who, you know, made a difference in your understanding or the approach to the subject?
Sir, a lot of teachers, Deepthi ma'am, her obstetrics notes are like everything and anything. I mean, it's complete. It's in all complete. So your notes, obviously, I mean, you do not need to read radiology from anything else. It's just your notes. And sir, every teacher, microbiology, pathology, like everything is from DAMS notes.
You were happy with your experience, that you're happy with your decision that you joined us in the
Yes, sir,
foundation year?
definitely.
Yes. So then you followed it up with a test and discussion.
Yes, sir.
And where the idea changes from anti-grade teaching to a test followed by a discussion, aggressive discussion. Did you enjoy that pattern?
Yes, sir. Because this is a very nice way of studying things. You prepare for a week and then you give a test. It gives you an idea where you stand. It also tells you where do you lag. So and after that you get a discussion. You get almost everything updated there. If you did not study something or something changed, you get to know there. And if you didn't study a part, you didn't give much attention to a part, you get to know this is very important, you must study this. So that's a very good idea, and it actually gives you confidence. If you don't get a good rank in one test and then you improve in other tests, it helps you to understand that yes, if we study, we can actually get better ranks. So that is also a very important thing.
Our idea of creating a TND test paper is that we want to include some updates. Yes. And we want to put sample questions from each topic, so that in the discussion we are able to kind of give a run through of the entire thing. So just in case you forgot to revise one topic, you will find you'll find out. That is the idea. So did you utilize the test series also that comes along with it, where you have grand tests? And
yes, sir, definitely. I love the test series because it is online and you can give it anytime. I used to give it in my internship days while carrying a patient for a referral. I'm doing nothing and just carrying my phone and giving the test. You study a subject, you are free. You can give the test anytime and you can actually see the solution videos. You can see the solutions, and like the time which would have got wasted, you can use that time. So that's a very good idea, I guess, especially for interns who are actually preparing at that time. So it won't let you feel that you don't have time. You'll feel कि बिना कुछ किए भी मैंने I have studied. So
I feel, that is my idea, that, I want to give you a planned distraction. That, when you're distracted, there should be something to go to. So one of them is the test series app, that, you're distracted, you don't want to study. And instead of, talking to somebody else, wasting time in gossiping, you go to the app and start doing test. And second thing that I have given as a distraction is that Facebook group.
True.
So how did you utilize that and the test series? And
so the Facebook group is it's actually very useful because you get to know all the updates, the recent updates, because we have joined the classes in foundation time. It was 3 years back when you give your exam. So a lot of things, staging changes, a lot of new updates come, a lot of new drugs come, and everything is there in the Facebook. You actually, if you get bored for some time, you can actually just scroll up. You learn 5 drugs, more than enough. At the time of eating, after eating, you learn something, more than enough. You learn some markers, more than enough. I mean, gradually it will build up your knowledge, and it will keep you updated also. And the exams are asking the new things. They'll ask you new markers, and then if you go along with the older things only, then there's some lag. And this lag, especially in central institutes, it is like making the game or breaking the game. So that's why you need to be updated.
They're more likely to ask the change thing.
Exactly.
Because central institutes, they are very fond of asking that this is the new thing, what has happened.
And that makes all the difference.
Yes.
So that's why.
So our goal here is that, our goal behind that Facebook group is that, you might be going to Facebook for a distraction also, you understand? Like, many people when they're taking a break, they think, okay, let's scroll the feed. But when you are with us, even that feed is full of MCQs.
Exactly.
So even that break becomes a utility. That is the entire thought process here. And I also want to know about the latest distraction that we have now created, called as the e-medicos. So did you utilize the mobile app?
Yes, sir, definitely. E-medicos is actually very, very helpful. Especially it's in all very useful, but especially I used to see the videos. I mean, that was something very, very much used by me. Sachin sir's video on psychopharmacology, Diksha ma'am's video on neoplasia, Deepthi ma'am's video on contraceptives. I mean, they're like everything. You see them, you make notes, and you will not need to study it from anywhere else. I mean, it's complete in itself. So a lot of many all the videos, I guess all the videos, biostatistics videos, they're so good. I used to hate biostatistics earlier, but then after that it was like a game of 5 minutes. So, like if you study for the whole day, you get bored. In the night, you can see for 1 hour, make notes, and just sleep. 3 to 4 days later, you'll complete a subject, you complete a topic. In the 5th day, revise. Whatever notes you've made, just revise them, and then that's all. You'll remember it forever. So,
and what about the special sessions that we conduct? Like before NEET, we do a DVT session, and before PGI, we did a PGI special session.
Yes,
any experience with those?
So DVT especially, it's very, very useful because once you get a visual image of anything, you remember it permanently. Even if you don't revise, you attend the classes sincerely, you tend to remember. You cannot forget it. So that helps you create an image in the exam, because we cannot revise everything in the exams. We cannot. The syllabus is so vast, it is not possible for anybody to revise everything. If there's something visual in your mind, you can actually get up to the answers, because and especially in AIMS and NEET exams, they're asking a lot of image-based questions. So many a times it happens that the same image has come from the DAMS DVT session, and you see there. So it's just like a game of 2 minutes. Ki, haan, ye to hame pata hi hai. So the PGI session was so useful for me. It had everything. The recent topics were discussed, the recent questions were discussed, and at the last time I just revised the PGI notes. I mean, everything was covered in it, and every important topics was covered in detail. Pharmacology mein the TB section was discussed so nicely, HIV section, antimicrobial section, basically whatever they are asking was discussed very thoroughly. So you get to know also what is important. You do not need to revise everything in the last. You know कि pharmacology में microbiology वाला section important है, so you just revise that. It's not possible to revise everything. Okay, fine. If 2 questions come from outside, you may remember it. Anyways also.
Because of your subconscious knowledge that you have acquired over the years.
Because you have studied throughout the years, so you are bound to remember. But it's just that if you revise something frequently, you'll better chances of remembering it.
Because in the end, you have to go towards the high yield.
Exactly.
Yes. So I also want, because you have done exceedingly well in a PGI exam, which is, many people, they target PGI exam as their goal in life. They want to go to PGI and do their residency, which you will be doing now. So many people listening to you today, they want to hear from you what was your experience about the exam this time. When you were giving the exam, what did you feel? What were the topics they were centering on? How did you manage the time and the multiple more than answer correct kind of thing?
The PGI exam, basically, it's one thing which is very important, which Sandeep sir told in his PGI session also, is managing the time. It's actually very, very important. Last time when I gave it in November, I could not. So I left 30 questions unread. That is a great loss. I mean, 30 questions unread is a very, very great loss. So managing time is very, very important. You need to be super, super fast. And you need to be very accurate at the same time, because the negative marking is very, very high. So you need to be accurate, and this can only be possible if you revise things very, very frequently. If you revise frequently, then only it comes spontaneously in your mind, and you can mark it. If you're not sure, do not. If you're not sure, please do not. This was Sandeep sir's voice echoing in my ears whenever I used to mark any option I was not sure about, and I used to feel like nahi sir ne bola tha ki nahi mark karna hai. I used to cut it. So please do not mark anything which you do not know about. Okay, PGI section is a much of a theoretical exam. I mean, they do not ask you images, but they ask you about the core deep theory, which we actually read in professional exams, and in the DAMS also it is covered. But like in the professional exams, if you have studied very well, like you joined DAMS in 3rd year, you study professionals very well, you join DAMS in 4th year, you study professionals very well, it helps you a lot. You remember it throughout. So that makes it a bit easier. Some of the subjects are very important: surgery, medicine, obs and gynae, pharmacology, pathology, and biochemistry. I mean, these are the things. If you do not have time at the last moment, revise just these subjects. And in these subjects also, they have well-defined important topics. You need to revise only that topics. Keep 4 days, 5 days for revision. Like I had a little bit of less time. Everybody has it. So just revise these important topics. I mean,
can you give some topics for future aspirants that you feel are important for PGI purpose?
Sir, in microbiology, they like to ask about spirochetes, leptospira, these kind of things. I mean, not the typical bacteria that we do read. So they ask about immunodeficiency disorders, immunology specifically. PGI, I mean, I myself feel that it is their favorite. They ask immunology in depth. Biochemistry mein DNA, RNA part, they ask in depth. I mean, they like to know about everything, ORF, A, B, everything. So biochemistry mein, then medicine is obviously, it's so vast, but still medicine mein jo recent cheezein hain, they like to ask it. CPR or ACLS, BLS things.
These are like important for all central exams.
All central exams.
Nowadays, all central exams are wanting you to be
like emergency topics.
Friendly.
They're more likely to ask. Obs and gynae, obviously, ma'am's notes are enough, more than enough. You read them, you get to know everything. And in that also, ectopic pregnancy, abortions, contraceptives, all that things are asked. So
yeah, plus what I've seen is even in microbiology or infectious diseases, even in AIMS they tend to go towards virology, mycology instead of the classic bacteriology that we read. So they tend to hit the fringes about the organisms that you may not be putting that kind of effort.
Exactly.
In
like in PGI they ask arboviruses very much. I mean, they're fond of it. They're fond of asking classes of arboviruses. कि कौन सी class को belong करते हैं, कौन सी class को, and it's very easy. If you read it once, twice, thrice, it's very easy because you know a question already. There's so many questions which you can already predict. With sitting at the home, you can know कि एक question apoptosis necrosis से आएगा, एक question will come from virology वाला part, most likely Ebola virus, Zika virus, and all these updates are actually present in AMS. So that was a very helpful thing for me because I had read these topics very thoroughly. Even if you miss out on some topics which are not important, it's okay.
Now I also want you to, because you've given us so many ideas about PGI Chandigarh, I want to know how many choices did you mark in the exam? Because a lot of people would want to hear from you. How many choices did you mark in PGI exam?
I guess it's about 500 to 550. I'm not very sure about it. But yes, it's my random guess that,
that is the
almost
kind of-
500 to 550 I would have marked.
Yeah, that is probably what I've seen. I've talked to many people who've done a good rank in this PGI, and they've
Yeah.
almost all done similar bracket. So probably
Because,
that was the number of correct choices in the
maybe.
exam.
So I guess the idea is not to mark anything which you're not sure about. It will eat up your positive marks.
Yes.
Just let things happen. What you know is more than enough. What you know is already more than enough if you do not let any negative thing eat your positive marks.
Plus, PGI is an exam where, you know, it's very different from other exams.
Yes.
More than one answer is correct. The negative percentage is very,
Very
high.
high.
You can't just put blind guesses and kill your career.
Exactly.
And time management becomes very critical.
Very important.
Because if you don't manage your time well,
You'll,
like she did in the first attempt, she could not read 30 questions. And if she had read those 30 questions, you know, this interview would have been done 6 months back, I'm sure. Because, but that is where the time management comes critical.
it's
That
very
you
important.
study very hard, you are a good student, you've done everything, you started early, but you could not manage time, and then so that is the message that I want you to take from this interview. Manage your time well in the exam. You can't just let go of questions because you have not read them in the exam. You could not read them.
That's a big mistake.
That's
A
a
big mistake.
big
You'll
mistake.
regret it throughout.
Yes. At least in
So-
her case, she could, you know, put it right in next 6 months so that the regret does not become longer. Now it is all ended well. She is ranked 12 in this PGI exam. She has almost all branches open to her. It is up to her which she wants to take. May I ask which branch will you be taking in PGI Chandigarh?
Sir, I've always been interested in pediatrics, and I'll like to take pediatrics only.
So I'm sure you will get pediatrics in PGI Chandigarh. And with this, now let me put you in a hot seat, and I want you to say something motivating for future aspirants.
Look, starting late, starting early is very important. You know, you have to think this right from the third year. Third year is the best time to think that yes, I have to start now. And for those who are seeing this and they are like in first year, I would say read your theory well right from now. If you read it well right from now, it will be very easier for you to go throughout the internship. Like things will be very easier. And if you start for third year, is no late to start. You start anytime. And there's nothing called as failure. Believe me, there's nothing called as failure. It's you fail only when you stop learning from your mistakes. Otherwise, there's just two options. You either succeed or you succeed. There's no other option left with you.
So with that note, you know, we'll close this interview today with the note is start early and learn from mistakes.
Yes,
Learn
sir.
from mistakes are a message that if you make mistake, you know, it is you're bound to make mistakes, but if you learn from them, ultimately you will
Like this time,
get
I
success.
decided I'll not leave any question untouched.
Yes.
So
So I think this time you were determined that my time management should be perfect.
Should be perfect.
Yes. So that you don't create a regret that I could not read questions.
True.
So with that is a big message going out here from Dr. Shaily Saraf, ranked 12 PGI Chandigarh this year from May 2018. She is a DAMS Foundation and a Test and Discussion course student, and we are very proud of her achievement. I would like to use this video to convey my regards and my congratulations to your parents
Thank
as
you,
well
sir.
and family
Thank you,
as well.
sir.
And I'm sure they must be a proud set of parents today with their daughter doing so well in a central exam.
So they are the reason I'm here. I mean,
Yes.
without them, I would not have been here. I get so sad in a moment. I don't get anything. I just start crying. And then there's my papa saying कि कोई बात नहीं तुम बस exam दे दो. Do not think about the results.
So that is where the emotional support comes
Exactly,
in.
and that's very important.
So once more, I would again wish you heartiest congratulations.
Thank you,
God
sir.
bless you.
Thank you, sir.
Congratulations.